Welcome to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. With me today, I have three individuals who are going to speak to us about the field of palliative care and specifically surgical palliative care. With me today are Doctors Geoffrey Dunn, and Jeff is at UPMC Hamot as Emeritus and is quite a legend in the field of surgical palliative care, as we'll hear. Red Hoffman is an acute care surgeon in Asheville, North Carolina, where she's an adjunct assistant professor in the Department of Surgery at University of North Carolina. And Dr. Pringl Miller, who's also a surgeon, is the founder and president of Physician Just Equity. Welcome, everyone, to our interview.
Thanks for having us.
Thank you for the invite. Yeah, thank you for the invitation.
Appreciate your time and appreciate your insights that we'll have over the next few minutes. I'd like to start out, if I might, with Dr. Miller, because I believe you were the impetus for our interview today, predicated on a recent recognition and major achievement by Dr. Dunn. So I'd like to start with you explaining a little bit to us about why we're speaking today and why surgeons need to know about surgical palliative care.
Thank you, Dr. Wexner. It's great to be a part of this discussion. We're here today, I think, to really honor the work, the lifetime work of Dr. Geoffrey Dunn that is being honored by the American Academy of Hospice and Palliative Medicine, I'm sure amongst other groups that are recognizing Dr. Dunn for his work. What is really amazing about this award is that it is a Lifetime Achievement Award, and they've characterized it as recognizing outstanding contributions and significant publications that have helped shape the direction of the field of hospice and palliative care. And I think that those of us who have been under the wings of Dr. Dunn know about the plethora of publications and mentorship and sponsorship that he's provided. I want to just mention that the first award for the AHPM Life Achievement Award was given in 2001. And it was given to another surgeon that we're aware of, Dr. Balfour Mount, and Balfour having been named after the Balfour retractor that we all have probably, worked with over our careers. So 20 years later, it's wonderful that another amazing surgeon is being awarded this award. So congratulations, Dr. Dunn.
Well, congratulations indeed, Dr. Dunn. And with that formidable introduction, well-deserved, please tell us a little bit about the work you've done that led to this award.
Well, it had many beginnings. I can't emphasize enough how important the college was in much of my work, and not only providing support, but rapidly providing access to individuals that I thought would rapidly develop this field. There was great depth. I come from a long background as surgeons, so for me it was almost as if we were rediscovering something that's an important part of our surgical tradition that perhaps had been neglected in more recent decades because of the eclipsing effect of stunning technical achievements. Actually, it was Balfour Mount who Dr. Miller had mentioned gave me the first gentle nudge to sort of take the concept of palliative care to the field of surgery. This was back in 1998. At that time, 97, that time I'd been working several years as a hospice physician, and I had just come to the realization that perhaps what I had been learning in hospice was directly applicable to the practice of surgery, not just for people with advanced disease, but people in earlier stages of illness with all kinds of surgical problems, not just cancer. And I asked him if he knew of people in American surgery that might be a mentor or could help me out with this. And there was a long pause on the phone. He said, well, that would be you. So that was how it all started. And very quickly I found allies, and I was mentored by one of the greats of college, Tom Krizik, who I'm sure you remember, who was a man of great courage and intellect, partly because he had made it very visible, the problem of impaired physicians he made numerous contributions to the Committee on Ethics. And he had gotten wind of my interest in this and invited me to a symposium where there was a panel discussion, which I've often seen as the launching point of surgical palliative care in the college, because there was a big debate about physician-assisted suicide, but it was obvious to me how impoverished we were in our thinking about care for people with complicated and advanced illness. And on that day, which I was allowed to speak, I promised the college I would do everything I possibly could to advance this field, but I needed the college's help. I was impressed how quickly some of the most senior, the most revered members of the fellowship stepped forward to help out. Dr. Jim Carrico, among others, were some of the earlier ones. Olga Jonassen, who went on and helped us in her capacity of Director of Education at the college, and then later with the American Board of Surgery. So I think the college, to me, was the vehicle to get this across. I think it would have taken a much longer time if we let this or awaited the idea or the concept to percolate through academia or just in general clinical practice.
Thanks very much. And again, congratulations on your very well-deserved award and lifetime of work in this field. It's a field that I'm not sure is terribly well understood by all surgeons, perhaps not by the majority of surgeons. And if you could please remember that our viewers and listeners for From the Front Lines Surgeons' Voices represent all different specialties in surgery. So it's not just general surgeons or colorectal surgeons, it's neurosurgeons, orthopedists, and otolaryngologists and the like. With the context of that broad audience, as well as the fact that our subscribers and our viewers and listeners include medical students and residents and fellows. Perhaps Dr. Hoffman, you could give us a little bit more definition as to surgical palliative care. Why is it important and what is its current role?
Sure. So I think it's just important to understand what palliative care is in general. So palliative care is interdisciplinary care, which means it involves an entire team, including physicians, and that includes surgeons, nurses, LCSWs, chaplains, wound care nurses, respiratory therapists, everyone who are really dedicated to the physical, mental, emotional, and spiritual well-being of the patients and the families who have either chronic, life-limiting, or perhaps life-ending disease processes. And so you can think it's really probably applicable to almost every patient that we have. And the great thing about palliative care and about surgical palliative care is that it is meant to be delivered alongside disease-modifying treatment. So that might be surgery, chemotherapy, radiation, as long as that's congruent with the patient's goals of care. And so when we think about why surgeons should be invested in knowing about palliative care, well, we can think of our surgical patients. There's a lot of suffering that goes on with our surgical patients. Again, whether it's physically, emotionally, mentally, or spiritually, there's a lot of symptoms that need to be managed in these patients. And then our patients' families and caregivers are also often suffering alongside their loved ones. I think one thing I've really learned from being mentored by Dr. Dunn is that anyone, any surgeon, any physician, any medical student can do this kind of work. And so a lot of this work is, I think, very heart-centered. It's the patient is at the center of this work. And again, I just think it is applicable to really almost any surgical patient.
Thanks. Now you've mentioned getting mentored and Dr. Dunn has mentioned getting mentored. And what is the educational pathway here? I mean, it sounds like we're all involved, every one of us, but is there a formal educational pathway? And if so, what is it?
There is a formal educational pathway for the subspecialty of hospice and palliative medicine, and that's changed a little bit since 2012, I believe it is, that now there's a 1-year traditional fellowship that's required to be board eligible. But I would also say that, Dr. Dunn was instrumental in creating the ACS product that is the surgeon residence palliative care manual. And the SCORE curriculum for surgical residents does have a segment of palliative care. One of the things that I wanted to just mention and follow up to Red's really excellent description is that Balfour Mount was the person who tried to distinguish palliative medicine or palliative care from hospice. And I think that's one of the things that's worth relaying to the audience today, is that when we talk about palliative care, surgical palliative care, we're really not talking about specifically end-of-life care or for patients that are terminal. This is, as Red said, a concurrent form of supportive care to disease-directed care, not for people who are dying, but for people who are suffering in multiple ways. There are also certificate programs, getting back to your question of educational processes, that don't require a commitment of 12 months. And one of the things that a group of us is trying to do is create a more competency-based curriculum that would still enable surgeons to be board eligible for the exam and become board certified, because it's obviously difficult for surgeons to rotate out of either their residency or their practice to commit 12 months of time to get board certified. So we're working on that, and hopefully that'll be forthcoming.
Thanks very much. And maybe if I go back to Dr. Dunn then and ask us a little bit about the scope of the program, the size. In other words, how many people are out there practicing who would say, well, I'm a palliative, surgical palliative care specialist, or currently in training, how many training programs, just to give us some idea of the scope and size of this endeavor.
I think there are some 60 or so, and Pringl, maybe you could correct me on this, ACGME fellowships for this. Not all of them are amenable to surgical applicants, and this has more to do with logistics of credentialing and covering. I think there are about 70 to 80 board certified specialists in hospice and palliative medicine who are they're diplomats to the American Board of Surgery. So the formal numbers are very small. But to get back to something you had alluded to earlier, I think palliative care is something that many surgeons innately resonate with and may be better prepared to do than they realize, even though the terminology may spook them out a little bit, about palliative care. Because I can't tell you how many times I've heard surgeons say, well, this is something I do all the time. I just know it under a different name. And what the formal training and the writing and now the research in surgical palliative care is doing is providing more tools, more framework for allowing surgeons to tap into those inner instincts that we have. Because I've always believed that surgeons feel just as strongly about relieving suffering in all its forms as they do about saving life. I don't think that's ever not been a part of the surgical personality. And it wasn't too long ago that really was the main activity for all surgery.
Yeah, thank you very much. Excellent insights. Perhaps we could close turning back to Dr. Hoffman, and given what we just heard from Dr. Dunn, how do we incorporate this type of knowledge and activate this type of practice, emphasize its importance in the context of another surgical curriculum, general surgery, cardiac surgery, whatever it happens to be?
Sure. So I think the place that I look to that's doing it the best right now is OHSU. They're under the direction of Dr. Karen Brazel. Every single surgical intern rotates through the palliative care department for a month. And so they truly learn how to integrate the principles of palliative care early in their surgical career and then carry that forward. So in my perfect world, that is going to happen, continue to happen, and that kind of mindset is going to continue to grow. As Pringl said, there's certainly some curriculums out there that you don't have to complete a fellowship to kind of learn more about this. I think that there's recently the journal, The American Surgeon, just put out like case-based study, like 9 case-based studies, so that people can, can just pick up and read about how to integrate some of these principles into your practice. And then what I always tell my trainees is that when any of us consult the palliative care team, the best way to learn is just to watch other experts in the field do what they do best. So attend those family meetings, pick up some skills. I always say this work is not rocket science. It's just very heart-based work. If you want the best for your patients, you can find some time and do it.
Well, thank you very much. That's very helpful information indeed. And again, please accept my appreciation, all of you. Dr. Dunn, congratulations. Dr. Hoffman, Dr. Miller, for your time today. And I wish you all a happy and healthy holiday season.
Thank you so much. Stay
Back
safe.
at you. Thank you.